All this is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. So the discussion now is the immune imprinting questions. We just did the discussion. Let's see. YouTube, you betcha, 108 says, everyone is talking about immune imprinting now. This is so timely. Really had to listen, still not sure about a conclusion. Do it advise booster to family members? Sound like no. Okay. The booster is a different question, right? And if we stay with the way I have always been, that I've never suggested to take vaccine or not to take vaccine. I've always informed what I have done and my family have done. We are vaccinated, but we are not boosted. My reason for not being boosted was that my immune system is imprinted. I have memory cells. So ideally these should work. And then you see that boosters nowadays are generally not very efficacious for the newer variant. Although, so if you would like to discuss this a little more from a mechanism point of view, there can be a good thing in the booster and a bad thing in a booster. So let me explain both. Here is the good thing. So let's say we have this original variant. This is ancestral Wuhan variant, right? And let's say the vaccine helps us produce memory cells against that is imprinting that we have. Now, here are some memory B cell that are sitting, waiting for their turn to react. Let me wear my glove. My hand is sticking to the screen. Okay, so here are some B cells. Now, let's say we have a booster. Or before that, let's say that we have a new variant, let's call it Omicron, and it has changed that seemed like a flipping. So let's say it has changed the spike protein enough that it can escape the memory cells. That means imprinting of bad type, right? That is when this variant arrives in our body, our cells are thinking they would attach with something like this shape, but here the shape has changed. These guys are going to attach somewhere randomly, and now the virus is still free to do stuff. So giving a booster will continue to strengthen this incorrect memory system. That is one possibility. I said, let's look at the good one. Let's look at the bad one. That is the bad part. The good part is, it is possible that every time there is a booster given, so let's say this is still the old Wuhan variant vaccine, and that booster is given. When that booster is given, our body will, of course, activate the previous memory cells, which are imprinted with the epitopes that may not be very relevant. However, there will be affinity maturation. Affinity maturation means this spike protein produced will be brought to the lymph nodes. Inside the lymph node, our follicular dendritic cells will pick up this spike protein, present it to the memory B cells that are sitting there, these guys, and say, hey guys, why don't you sharpen your skills of binding with this new epitope? And so these memory cells will become trained for the newer variant. And they will be trained, let me not say newer variant, they will be trained for more parts of the spike protein. The more parts they're trained on, there is for sure going to be some parts that are going to be for conserved areas of the spike protein where attack can occur even when the variant is different. So that is how boosters' behavior will be. The way to look at boosters is age, comorbidities, previous vaccine dose time, the risk to their health, then decide for the booster. Um, but that is the general concept. I do not think, so this is now my think part, and I know I'm going to get some unsubs because of this. I do not think that the vaccine is causing imprinting enough to cause damage, meaning imprinting in a negative way. Imprinting means memory production and response, but negative imprinting, I don't think vaccines have shown. There is no study that is showing that. Anecdotally, people say that every breakthrough infection is a proof that imprinting has caused attack on the incorrect parts of the virus, and virus was able to continue to replicate. What they forget is respiratory viruses will infect us. This is correct. So they will infect us. So infection is not a proof of imprinting. If the infection is severe, then that is a proof that the immune system was not able to handle it. Now, is it because of the person's habitat, their imprinting, or their other risk factors? I don't know. That is the part that cannot be generalized. So, meaning if somebody wants to have a booster, it is totally their discussion with their doctors, but vaccine itself is not causing imprint. It can cause other issues. We are seeing that adjuvants are causing issues. Vaccines are causing cardiac problems. Vaccines are causing clotting. Vaccines could cause more issues. That is all different. Imprinting's context, I have not seen any studies that are saying imprinting by vaccine is causing damage. Okay, let's see. Doug says cytotoxic lymphocytes shouldn't be troubled by non and neutralizing antibodies. Correct. But cytotoxic lymphocyte also have T cell receptors and similar behavior. So it is possible, for example, in dengue fever, there is no study for the imprinting problem with the SARS-CoV-2 so far. Dengue fever, hemorrhagic dengue fever, is a situation where the cytotoxic T lymphocytes misbehave. And the re-exposure, when it occurs, instead of being cytotoxic, the cytotoxic lymphocytes just simply release some cytokines and become quiet. Those in turn actually cause such aggressive infection that hemorrhage occurs. So again, this phenomena with the SARS-CoV-2 yet is not seen. If tomorrow a study comes out and shows it, we'll discuss it, we'll agree and understand it. But at this time, there is no study that shows imprinting. There are studies, for example, let me go back. There are studies that say imprinting is possible. Here are the studies. This study, in the first, so let me read it from here. Recently, 2 studies were pre-published dissecting the antibody response of such Omicron breakthrough infections. In the first not yet peer-reviewed preprint, Quant et al. Say Omicron breakthrough infections increase the frequency of pre-existing memory B cells that recognize conserved epitopes rather than eliciting new B cell against Omicron-specific epitopes, thereby highlighting the importance of antigenic imprinting in SARS-CoV-2. So this study says the new variant came in, but the person was vaccinated with the previous one, the Wuhan spike, and they just kept making antibodies against the Wuhan, and the Omicron just ran around at will. I'm visualizing it. That's not how they said it. So this is an example of imprinting gone bad. The second study is totally the other way. And so this article actually presented both ways and said, look, there is a study that says it can be bad. There's a study that says it can be good. However, I haven't seen any study that says because of imprinting, the person will become severe. Okay, so next question. Let's see. So I saw Texas Max comment a couple of times that this is yes, no, maybe. Actually, I talked about the imprinting's concept. The concept of imprinting can be good. Microbiome can make our system imprinted in a good way, immune system. Under the skin, our immune system imprinting occurs in a good way. Our memory against a pathogen, when it becomes the memory and when the pathogen arrives and we are imprinted with that pathogen's memory and we attack it and we take care of it, it's a good thing. I'll give you an example with vaccine. We have been hearing this, that vaccines are not protecting from cases, even hospitalizations, but their protection against severe cases or death is better than protection against the cases. That is actually imprinting in a good way, meaning training of the immune system, helping to take care of the virus before it becomes too dangerous. Now, in some people, it doesn't work. There are people who are still dying who are vaccinated as well. But it's not that all vaccinated are dying, or it's also not that all unvaccinated are dying, or it is also not that all reinfections are dying because they have imprinting. So all categories have to look at immune system state, person's state, variant state, body's response, imprinting, and so on. Golden Time says, if I got COVID recently, mild form, then should I get vaccinated after the infection? The adaptive arm immunity by the new variant will last how long? So, look, I cannot offer an advice, right? Because that's just not possible. Even if I was a licensed doctor in the US, even then I cannot sit here and provide an advice, right? It's not ethical. But I can talk about this, that if I have infection and it was mild, then in theory, vaccine's job is to protect me from the severe infection. And if I can already be protected, then I'm fine. One answer. Second part of the answer. Veterans Affairs study that came out a few weeks ago. That study is it needs to be repeated. Veterans Affairs study said every time a reinfection occurs, it is severe. So one should get boosters or vaccines. Somebody said to me that you have this reinfection and this time you had shortness of breath, so maybe that is severe. So yes, if we call shortness of breath severity increase, then yes, it was severe. But if we say that runny nose, cough, sore throat, disability of that kind, then I felt nothing. Correct. So this will again mean, what is my age? What is my state? What are my comorbidities? What is my condition? Correct. So Veterans Affairs population was, number one, more at risk, higher age, people who were already going to hospital for other reasons. Compare that to Qatari study, where they said the infection protected from reinfection for months. So durability was great, plus intensity was less. I would consider that Qatari study actually meant in youngsters, the situation is different. And that's what I saw with my son as well. He was tired one day in the morning, and even then he was not agreeing that this is anything. One day, and not even one day complete, couple of hours. He woke up in the morning, went to do the dishes, standing with a wider stance and saying, well, I'm tired. And then he went back and started talking with his friends on the computer, and he's been fine since then. So it depends. Sunset says, so how does tonight's presentation relate to the annual flu vaccine when the flu is slightly different the next year? So flu does the drift and shift all the time. So that means the previous knowledge of the flu is actually the antigenic sin or imprinting in a bad way, that we try to attack that flu, but it doesn't really help because a newer one has changed while the previous epitopes are also present. So we are attacking the wrong parts. However, there are also studies for flu that say that the previous knowledge of the flu variants of our body, that is imprinted state, is actually helpful to continue to protect us from a broader range of flu variants. So that means it is one, it fails because the variant changes. And second, it protects as well. These are good questions. Kando says, Dr. Bean, what's going on in Japan? Let's see. Our world in data. I'm going to share my screen. Okay, so Japan. Oh, look at the cases. Man, look at this. They never had this number of cases before. Is this that they're counting better than us, or they actually have such cases? This is 204,000. This is 7-day rolling average due to limited testing. Number of confirmed cases is lower. It is still lower. And their previous peak was 86,000. Their current peak is 204. So 2.5 times. Now, if we go to what Paul had taught me, look at, let's say, this graph. Why does it remove? Let me get Japan back on. Move. Then if I go to cases, hospitalizations. Okay, so huge number of cases compared to ever before. And so in relation to that, then ICU, high number, and deaths are also high. They're not as high as previous. For example, in the previous number of cases, they had a very high number of cases and the death numbers were high as well. This time, the number of cases is 2.5 times more, but the deaths so far are 0.87 compared to 1.84. So lesser than half. Similarly, their ICUs are lesser than half as well. So it is not as high, but yeah, it is high. That's a very good question. Golden Blaze Dale says, what's the difference between imprinting and ADE? You tell me. It's actually a beautiful question. It's going to take some more time. Let's do it. I'll try to be as simple as quick as possible. Do you think people are going to watch the previous video, which was more than an hour long? I think that they're going to watch it and then they're going to see that it's not. I don't like to be someone who's just criticizing one area or the other. I like to discuss the mechanisms. Okay, so back here, imprinting. This is imprinting. In the imprinting, what is happening is the negative way of imprinting is that memory causes the production of antibodies which attach to a pathogen in a binding way but not neutralizing way, and so pathogen can still survive. So the response is inefficient. Although I discussed a study from Sweden that says this is actually a good response. You don't want too many neutralizing antibodies because that causes Poisson and hook effect, which actually reduces the immune system's behavior. So they said some binding antibodies, some neutralizing antibodies are actually a good combination. So this is the imprinting. Now imagine the same mechanism. Imprinting occurred negatively, and we have this variant that has, am I sharing my screen or not, that has antibodies, let's make them in red, attached to the areas where they don't really, they're not neutralizing. Make them here on spike. Right, so they're not neutralizing. That means the virus is still able to bind with ACE2 and maybe even enter the cells. Now, ADE is the concept that these antibody that have, this is called opsonization, right? Coating, opsonization, coating of a virus with complement system or complement proteins and antibody and or antibodies is called opsonization. Opsonization means coating a pathogen with these things so that a macrophage or an innate arm cell can easily grab and digest and phagocytose it. Opsonization means making a pathogen suitable for phagocytosis, or as I say to my students, making it yummy for phagocytosis by coating sweet antibodies and complements on it. The concept of ADE is the following. Sometimes, not sometimes, always, these antibodies can actually bind, and this is their normal physiological function. They can bind on innate arm cells, for example, macrophages, dendritic cells, neutrophils. They can bind there, and then this whole complex, antibody and antigen, the pathogen, are brought into the cell. This is a normal physiological function, and then digested and broken and destroyed. However, ADE means antibody is there, antigen is there, we bound with it with a normal immune cell, we brought it in, but instead of getting destroyed in there, it becomes active and destroys the cell and infects the cell in return. That is ADE. So ADE could be a mechanism after bad imprinting, meaning immune system caused imprinting, antibodies are coating the pathogen, they are not neutralizing it. Coated pathogen, instead of just getting phagocytosed, it is getting phagocytosed as well, but some of those antibodies are being picked up through their constant region by the pathogen, causing, so ideally they should be destroyed inside the pathogen should be destroyed inside the cell. It's not destroyed, it gets released and freed and attack the cell and destroy it. That is ADE. Now, interesting question here. Has ADE been observed? So far, there have been conjectures that there will be ADE. There have been even hypothesized studies to say this behavior seems like ADE, but there is still no study that shows ADE. Dries Cool, which says, could it be the immune system becomes weaker after mRNA therapy because of the cleanup required of the spike protein? Do we understand proteins well enough to do these alterations? It's a good question. So, first of all, the basic idea of immune system becoming weak is not actually a proved idea, not proven for SARS-CoV-2. There are folks who say it all the time. I'll tell you exactly the kind of statements that are out there. European Medical Agency said if you continue to give boosters again and again, you're going to cause T cell exhaustion, which would then in turn mean that immune system will not behave correctly when the virus would come in, and let's call that immune weakness. That is a hypothesized mechanism still never observed. And maybe it is observed tomorrow. Maybe there is a manuscript in the approval processes to be published tomorrow. But so far, nothing. So that's one possibility. Then there are some thoughts which are very popular that presence of the vaccine would cause innate arm to become weak. This is actually more incorrect and more damaging. Damaging because every time there is a discussion of some vaccine mechanism that is destructive, vaccine has bad effects as well. Vaccines are not all good things. There are bad mechanisms attached with them too. Fortunately, that doesn't happen in everyone, just like virus doesn't kill everyone. And I am not unaware of the injuries. My family, my wife has had the injury. Fortunately, she has recovered. My niece had the injury. She has recovered. My best friend had the injury. He has been recovering. So I'm not unfamiliar to the injury occurring. However, think about it with me for a second. Let's say, remember we just discussed that we have an innate arm and we have an acquired arm or adaptive arm. Innate arm has these macrophages and dendritic cells and neutrophils and NK cells, right? This looks like a human being. So macrophages, dendritic cells, NK cells, neutrophils, and so on. Adaptive arm has helper cells, B cells, cytotoxic T cells. The thought is that if the vaccine is given, then the innate immune system, this system becomes weak. I don't even know what do they mean by weak. In one manuscript, that person said the cells are depleted. They have been maturing their, with people's objections, they keep refining their statement. But at the end of the day, let's think about it together. If somebody's innate arm is destroyed, weak, not working, then they will not only not work for SARS-CoV-2 correctly, they will not be able to handle any infection correctly. And let me prove it. Our innate arm is the first responder. Every single moment, we are exposed to hundreds and thousands of pathogens that are arriving in our body. Some from the oropharyngeal area, some from the conjunctiva, some from the skin wound, some from other areas of the body. Microbiome, we just have pathogens everywhere. Anytime there is a pathogen that is going to become dangerous for us, what happens is the first responder is the innate arm. Innate arm is called innate, non-specific, because it has to generally help us. It does not know various pathogens. Adaptive arm has to bind with a specific pathogen to be able to attack it. If adaptive arm cannot bind with the pathogen, it does not attack it. That is the concept of the imprinting. But innate arm is non-specific. If we say that innate arm is weak, then in an unspecific way, innate arm will not be able to handle any of the infection, and we would die within a few days. or will become severely ill with infections and cancers in few days, depending upon how weak the innate arm is. But interestingly, the folks who keep saying that the innate arm will be depleted, will be weakened, they have provided no mechanism, or the mechanisms that they say are not actually provable anywhere, that show how the innate arm will become weak. So if I go back to your question, Dries, could it be that immune system becomes weaker after RNA therapy because of the cleanup required of the spike protein? Spike protein produced by the vaccine is still not more than the spike protein produced by the infection. So if we are saying that the infection can be handled but vaccine cannot be handled, that is not correct. I think in every discussion we have to agree with this, and we have to concede that in some people infection is horrible, can cause lethal outcomes. In some people vaccine is that way. I have interviewed patients who are still suffering badly. And I can tell you a few days ago when I had I think the exposure, the palpitations, just the palpitations were making it so difficult to deliver these lectures, to have a normal quality of life. I would wake up, I will not be able to go to sleep. I will become anxious for the palpitations. I'll become breathless. So imagine someone who has palpitations, who has this buzzing feeling, who has um, shortness of breath, who has fire or burning sensation throughout the body, who has neurological symptoms all the time. How horrible that experience is. So there are that happening too. People are disabled by vaccines, just like people are dead by infection as well. So, Dries, I think the second part of your question, do we understand the proteins well enough? No, we do not understand the spike protein well enough. Every day there is a new study that shows a new destructive mechanism of the spike protein. I am baffled by the type of mechanisms it can trigger and the damages it can do. It's very strange. Saski says, me too. I'm trying to work out my way through positive stress test. It's scary stuff. It is very just, I mean, look, so I don't want to discuss your situation and put my situation in front of you. That is sort of not the right thing to do. The reason I'm going to put my situation here is to acknowledge how much people are suffering. My suffering was palpitations, shortness of breath, fatigue. To which some people say, well, this is just anxiety. So this is a normal behavior that if you go to doctors, even they would say this is anxiety. Some cool bean said, why don't you get your heart workup? We think that there may be something wrong with your heart. So I actually went to the doctor and I said, hey, I had the shortness of breath. I had these palpitations. Can you please help me with my cardiac workup? So he did thyroid. Actually, I just received the test results this last night and today and some yesterday. Thyroid normal, renal function, GFR normal, creatinine normal, sodium, potassium normal, the cardiac EKG normal, troponins normal, BNP normal, D dimers normal, and the stress test and echoes are scheduled, meaning there's nothing at this time. So with such more stable state, I was um, I was just bothered. I'm not afraid. Somebody thought that I was afraid of the virus. I'm not afraid of the. I don't wear masks anymore. I have my vaccine. I had my infections. I'm done. I go out and interact with the people without masks because I think it's just my body has to handle it now. So it's not anxiety that I was afraid of it, but that caused so much disability. I can imagine how Saski, uh, as you are saying, positive stress test as well. It is just so difficult to go through this. It's very difficult. Just the palpitations, just the breathlessness can change. The fatigue, just the fatigue. And there are people who are suffering. Okay, so I'm trying to say, yeah. So somebody who asked this question about spike protein, no, spike protein, every day it seems like it can damage in a new way. So Joel, fortunately, I didn't have the ectopic beats or prematures. It was sinus rhythm, but it would just become fast. So fortunately, um, my EKG was sinus rhythm. There was no indication of previous damage or any hypertrophy or MI or other damage. Or my heart sounds were fine. There are no murmurs. There are so what is still left at the table is constrictive cardiomyopathy, and that will become clear with echo and stress tests. So these are now scheduled. Stress test is echo is not yet, but my cardiologist said, I have a very good cardiologist friend. He said, I'm not gonna assume you're gonna get any of those. Your current tests have already shown me enough that you're fine. Okay, so um, Connor says, how protected am I from COVID-19 if I've only had Omicron in January? No other exposure to virus. I'm healthy, 31-year-old who gets out in the sun a lot. So getting out in sun is excellent. Guarantee I cannot give, but I used to say it this way, that just like if somebody is sleeping, waking them up to give them a sleeping medicine is not the best approach. Similarly, if somebody is healthy, they have shown that they can encounter the virus and come out on the other side healthy, then they actually have protection. So if I use Qatari study for your case, and please, I have to first give you this disclaimer that I cannot um, provide a message for one person. It's not for you. Qatari study, the population is younger, right? So their average age is 30, 35. And one infection was providing them protection, duration of protection up to 15 months with Omicron. And if somebody was infected with before Omicron variants, then up to 32 months. And severity of protection very light as well. So that is their relatively young population. And we are talking about unvaccinated. We're not talking about vaccinated. So I did that discussion a few weeks ago, vaccinated versus unvaccinated Qatari cohort. So if you read that or if you watch that, if you would not like to watch, let's say 30 minutes long video, then in the description of the video are the links to the discussion, and you can see it that they fared very well. Compare that to the Veterans Affairs study from the US that showed every reinfection makes it severe. But Veterans Affairs is a different kind of cohort. Their size, their age is different. Their comorbidities are different. Their socioeconomic statuses are different compared to Qatar. The stresses are different. Our habits, by socioeconomic, I mainly mean our habits, the eating habits, and our general health habits are different. But young, generally healthy individuals, Qatari study has a very interesting um, data for them. Raghav says, will a flu pandemic be worse than this? No, because our body has so much imprinted flu data in it. So, as much as people say that imprinting is bad, no, we become protected from flu because from our childhood exposures, we have so much knowledge of various epitopes, that even when flu shifts so much every year that we have to make predictive vaccines, we still are doing very well with it. So, again, at risk people are not doing well, but general population is. So Frank says, tell us your medical or research credentials. I was surprised when you just said that you were not a licensed doctor in the US. So no, I am a medical doctor. I am not licensed in the US. Neither do I practice, and nor do I plan to practice. My degrees are actually back here, and I am a medical doctor. I teach medicine, as you can see. And you're putting my doctor in quotations is not quotation doctor. I am a medical doctor. John says that last talk and the drawings were so awesome. One for the ages. I'll watch it again. Thank you very much. Broken Forever says, for kids the innate system is much different from adults. Isn't it technically weak because still developing? Would the overexposure from the jab make immune system not regulate normal? So one, I have always been very careful about pediatrics. I have no experience on the pediatric side at all. Number one. Number two, I'm very careful and sensitive about kids. With that, I cannot talk about one child or two child. Generally, children's immune system in the first 5 6 months is really weak. Why? Because when they were developed in the mother, they are not exposed to the external infections. So they have been given, mother gives them a gift of antibodies, IgGs, through placenta. So children are born with IgG circulating in them from mother. And mother has those IgGs based on the environmental factors. So if they are within the same environment, they get some protection afterwards. Then 5 6 months later, many of these IgGs have disappeared, and the child's immune system becomes mature enough to start developing, but not good enough to become fully developed. And that is when the vaccines come in, and we give the vaccine and kind of boost the system a little more. But yes, in the beginning part, their immune system is not fully developed. 5 6 months later, then they are fine. Doug says, Kaku et al. Found this spatula person effect didn't happen. Antibodies against new RBD created. Does it? Yes. So, or Poson effect, Prozon effect. Kaku et al. Found, this is very interesting. They found that when the vaccine was to the previous variant and the uh, Omicron was the breakthrough infection, they actually saw that the antibodies were produced towards the previous variant. So that is the negative part of the imprinting. However, soon the antibodies of the new variant attacking the new variant started becoming available as well. So that means new B cells or affinity matured B cells started becoming active. And so the Omicron related antibodies started coming into the effect. And so that is an interesting one. So they didn't talk about Prozon effect, but they talked about how memory system upgraded itself towards the newer variant. It's a beautiful study. Okay, Sir Paul Muad'Dib says, just to clarify a previous question regarding fleshing out spike proteins, I was referring to spike protein from messenger RNA vaccine. New studies show it's still in the body after 4 months. I actually, Paul discussed it. That study that shows it to be in the body for 4 months, I've discussed it. Present in the lymph nodes and doing affinity maturation, that is possible. The question really is, and this question is still not answered because they stopped the study after that time. So we don't actually know how much longer it stays in there and which cell continue to produce it. If these are the cells that are living in the lymph nodes, then sure, that is their function. They are doing it. But why after 4 months they are still being made? The quantity in the beginning of the vaccine generated spike protein is almost the same as the uh, infected patients' spike protein. And I discussed that study as well. And that was a Stanford study. And when I discussed it, um, Twitter and Facebook tagged it as misinformation. It was a Stanford study. So this is the strange part of this whole situation, that even when the studies are coming out to say, here are the areas of concern, there is an active suppression of it. The result of that is that then people come up and they say everything is bad about a vaccine. And that is because of this behavior. If our healthcare authorities say, you know what, here is a person injured, here is a mechanism we found out. For example, a few days ago, weeks ago, Harvard School of Medicine, right, researchers from there, they did this research on 54 patients and said that Omicron has escaped substantially the protection. And our healthcare authorities started using it everywhere, saying the escape has occurred, go get the vaccines. So it is not that they are unaware of these studies that are coming out. They're just very selective. That is what I dislike about this whole situation. This selectiveness is causing people to panic, to become angry, and then the whole both sides are becoming more and more anchored. This should have been a very simple thing. Here are the good things we know, here are the bad things we know today. Tomorrow, here is one more study. Our previous messaging needs to be corrected in the light of this one. Here is something new we know. Here is the risk we know. Here is the benefit we know, both infection and vaccine. If that data was out there and we were able to go to that data, see it, we would have trusted our leadership so much more. So Paul Muad'Dib says, do you believe the spike proteins are not being flushed out or worse, being reproduced by the body? So there is only one doctor and his team, Dr. Bruce Patterson, who believes that S1 protein hangs out in monocytes for a longer period of time, even after 15 months. He has not been able to say it is being reproduced or there is a virus there or the spike itself is being generated. All he's saying is that spike hangs out in the monocyte or monocytes are not able to digest the S1 part. Why not? It's not known. And is it in everyone is also not known because most of the people he has in his cohort are patients. So to answer your question, I do not know, because the last study said germinal center spike production up till 2 months, they saw it. Then circulation up to 4 months, they saw it. I actually discussed that study. And I remember when I discussed it, I thought they stopped the study after 4 months. it would have been great to understand more. What they said was that the amount of spike had become low enough that they thought after 4 months it's gone. So I do not believe that it is causing cells to produce it continuously, but there are germinal center cells that are making it, or it is present there for why for 2 months. So that is still a part that is out there. Brian says if spike cannot be cleared in monocytes, each infection more and more would get infected, so there would be never be reduction in these. So that is a problem in some people. So once again, think about it. Not everyone becomes vaccine injured. Not everyone dies of the infection either. And I'm sorry, my cat, today my wife is not home, so um, I close the door for the cat. Anyways, um, so monocytes hang on to, in some people, hang on to S1 even for 15 months. I saw their latest, they said even 15 months. So yes, why is it doing that in these patients? How long would it be there? How can we clear it? I have done some discussions for the possibilities of trying to do autophagy, but yeah, it is. Now, your question, if spike cannot be cleared in monocytes, each infection more and more would get infected. So you're correct. If spike continues to get accumulated more and more, then we have a problem. But it does not seem to be occurring in everyone. Sky Frog is here. Hey, Sky Frog, how are you doing? Frank says, I didn't intend to be insulting with my previous question or quotation marks. I love your channel and value your insight lectures. Thank you very much. I become a little upset with this, especially with the quotation marks, because we have, at least for me, for last 2.5 years, as sincerely as I've tried to bring education, I believe that I'm one of the people who have never tried to take a position to say vaccines are good or infection is good or vaccines are bad or infection is bad. Instead, I've brought the educational material like a medical teacher should do. I should not take a side. I should present the data. And that data should be useful for general public. It should be useful for doctors, for nurses. I have so many physician folks, friends who send me messages that, hey, I watched your video, I understood this part, now I talk with my patients in this way. There are so many patients, there are so many nurses. So that is my role. And this is the biggest attack that continues to happen on me. So it makes me sometimes a little on the edge, but all good. Thank you very much for clarifying. Susan says Luffy's rebuttal corner. Yeah, he's standing out there. So my wife has traveled to her family. She's there for, I think she's going to be there for 10 days. So I am the Luffy's mother and father in the meantime. Golden Time says Dr. Bean and Dr. Najib are extremely talented medical teachers. Thank you. And we are real brothers as well. And here come the naked people as well. Let's block them. Done this time. Oh, somebody had already blocked them. Skyfrog says, are you still having people attacking you? Yes, but it has reduced. And to give you update on the attacks, I think we have finally won all. Doug says she's left you. No, she went to meet her auntie. Remember I talk about a niece of mine who was vaccine injured? So she went to meet that family. She's her auntie, meaning she's the daughter of her auntie. Pamela says, I really appreciate your honesty. Thank you very much. Sometimes people get frustrated with me because they want me to take a position. For example, this previous lecture, I'm sure there are going to be so many comments that would say, so tell me it is good or bad. And I have never put myself in a position to do that, because that, I think, as a doctor and as a teacher is wrong. My job is to bring the, for example, for imprinting, I'm seeing so much disinformation. People just continuously making these statements. To me, a person who knows medicine, who teaches medicine, when I read their statements, I know clearly that they know. They're not children. They're doctors as well. They have spent their careers being medical doctors. They know that imprinting can be good and bad, and imprinting simply means body's knowledge of the previous before mutation state. They know it. And then deliberately, I believe, they make such statements. And it bothers me, because I think that is done either to feel that I can influence people, or maybe there is some money in it, followership in it. I don't know. And I have always tried. I have, you know it, that I have sometimes made mistake. I still remember that pregnancy study that I did. I totally used a wrong site which analyzed it wrong, and I presented it. And overnight, somebody said, you used an incorrect site for this analysis. And I sat down and I looked at the numbers again, and I was wrong. And I remember the next day was Saturday, which I don't teach on Saturday and Sunday. But in this case, I took that video down. I did one more video to clarify, just so that some pregnant women, some daughters, sisters, wives, they will be scared, they will be nervous. And I didn't want that. And I corrected it. And not that I corrected it incorrectly. That was the correct thing. That site I used was fear mongering incorrectly. And so I have made mistakes in these kind of ways, and I've tried to correct them. But there are people who just deliberately keep doing it. Doug says, why not use Cool Bean Cafe channel? I wanted to. However, what happened was, yesterday and today, I thought there would be Q&A for the topic before. And I just wanted to do that here. I will go back to the Cool Beans Cafe channel. Dry says, while under the effect of mRNA therapy, could it be the immune system has less resources to combat a COVID infection? No. So please realize our immune system is continuously handling infections. Having said that, let me back up for a second. Whenever we are infected with one thing, even vaccine, at that time, yes, our immune system is down. This is why we get secondary infections. We get viral infection, let's say runny nose, and then we get congestion and the sinusitis as well, which is bacterial infection, for example. So yes, our immune system can become temporarily down, which can create opportunistic situations for others. Now, it doesn't happen in everyone. So once again, generalized answer would not be correct here, that this would happen. But in some people, it will be that they have taken the vaccine, their immune system is busy, now they cannot handle anything, including COVID. COVID will be another burden. This is why it is actually important that at least after the first dose, just treat yourself as you are not vaccinated. Janet says history will be very kind to Dr. Mubin Sayed. Thank you. Indeed. Thank you. Photo clerk says, I'm a victim of a doctor who couldn't bother to stay current. Your work is greatly appreciated. I'll tell you some story. One of my close doctor friend, of course, majority of my friends, my class fellows, my circle is doctors. This was a close friend. I remember when in the beginning of COVID, I started teaching. This friend of mine practices internal medicine. We had a video conference call as a family call. We called them video conference and we were talking. In that process, he said that, what are you teaching nowadays? And I said, COVID related. And I mentioned a couple of concepts and I saw a smirk on his face. And I knew that he was just totally looking down upon whatever I was presenting. And I thought for a second, he's a very good internal medicine doctor. But I thought for a second that he's not going to update himself for COVID and his patients are going to suffer. So this is a problem. Gary says, brilliant depth of knowledge. Thank you. Yep. Ra says, if the spike protein is not clearing the body months down the road, could it first affect someone infected, vaccinated months down the road? So I didn't get the second part. Could it first affect someone infected, vaccinated months down the road? Ra, I could not understand the second part of your question. I'm so sorry. Can you please elaborate a little more? James Nguyen says, history kind to all. Good. Gary says, done a great job, Dr. Bean. Thank you very much. Robin says, will you be discussing the German vaccine injury data study that has been released by Paul Ehrlich Institute, the authority responsible? So, Robin, send me the link. I would go over it. And then if I get a chance, I'll present it. Lisa says, this is part where why people are fearful of dog. Yes. It's just very strange. And you know that in the American healthcare system, the algorithmic part of it, where doctors are given algorithms to say this is your algorithm or protocols, that has actually created a bigger mess because doctor can follow a protocol and say, I did what I was asked to. They don't actually have to think because protocol protects them from liability. It protects them from getting sued. And so that's their best bet. And that's not best for the patient. Golden Time says, Dr. Bean has astonishing depth in knowledge and also kudos to his courage for making unbiased opinion. The courage part, second part is interesting because a few days ago, one of my videos was posted by another organization. And someone wrote below that, why did you post a vaccine apologists video? And I thought I have actually never apologized for the vaccine. I actually was one of the earlier ones who said vaccines are causing problems. We need to get ahead of them. The folks who have been here, remember December of 2021 that I started talking about clotting. That is when the vaccines were just starting. And I started talking about clotting because of the trials results had it. So I've never been apologist for a vaccine. But I'm actually taken both ways. Vaccination, pro-vaccine folks think I'm anti-vaxxer. Someone who is not vaccine convinced, they think I'm a vaccine apologist. This is the price to pay to stick to medicine. It's not to be in the middle. I'm not trying to be fair and balanced to both sides. It's not news. I'm trying to be a medical doctor who is sharing. Here is a drug. Vaccine is a drug, a therapy, an intervention. Here are the things good it has done, and here are the things, side effects that it is doing. That's how medicine is taught. Yes, I remember. James Drbeen says, "You are Claude, Dr. Back." Yes, I paid a lot of price for that as well. So, Sir Paul Modib says, have you discussed vaccine spike protein shedding where a vaccinated person can affect a non-vaccinated? So, I know that Pfizer's document says that a woman said that she had the shedding. It's not that the Pfizer document says vaccine sheds. I am still looking for actual study for the shedding because, okay, now we're going to go into a very weird rabbit hole. Let me explain that rabbit hole. Nobody has ever actually connected these dots. So, first answer, there is no study show shedding. There's nothing yet. That doesn't mean tomorrow there will not be a study. Pfizer documents paragraph, I've read that. That is nothing. That is, a person said somebody shed the vaccine and that is why I became sick. They had to put it in there as one of the person's experience. They cannot say, no, we will not take it. However, okay, so promise me that you would not use this to say that we shed, because this is a conjecture and I'll show you where the possibilities are and where the possibilities are not. Let's go to our respiratory area. Let's say this is our respiratory area. This is our mouth, right? And there are walls. So let's say these are cells. Some more cells here, right? Mucosal cells, cells here. You get the point, right? The mouth, this little cavity, is surrounded by the cells, right? These cells are secretory cell. They secrete. That is how we get saliva. The cells that do the secretion, it's not necessary that all of them are secretory. I mean, our cheek sides of the cheeks are not secreting, but still they can secrete this mucus. Then there are salivary glands that actually make the saliva and actually create the mouthful. So what happens is, if I go and create a little boundary here, this is, let's say, a cell. On this side of the cell is the mouth cavity. This is the mouth, my mouth, for example. On this side of the cell is blood vessels that are bringing in blood, and they bring in nutrition and take away the trash and bring in oxygen and everything, right? A cell that is going to secrete something, that cell normally has a very interesting structure. It has this little triangular structure. If Parth is here from medical college, he should discuss this. Parth, are you here? Do you know that in histology you must have read these secretory cells, right? So what happens is, this is a special type of a cell. When it secretes something, it makes that little thing to be secreted, a little pocket of thing, whatever it is, let's say saliva, and then it would pinch off a part of this little apex of this cell. It would pinch off, and in here will be, in this pocket will be the saliva, and when that pinches off, this little secretion comes out. Then some cells have channels to reabsorb some of the things that they don't want to be going out. So this is how a cell's secretions work. Now imagine let's say there is vaccine generated spike protein that is, let's say, in the blood. For this spike protein to enter the mouth area, then to be shed from there, it has to first leave the blood vessel, then it has to enter this next cell, then it has to become part of a secretory globule, and then be shed out here, and then it can get out. There has been no study that shows this whole mechanism is possible. So then why did I say that you promised me that you would not? Here is the second thing. Again, there is no study that has shown this. Cells can produce exosomes. Exosomes are basically lipid particles, just like vaccines are lipid nanoparticle that we give from outside. And these lipid nanoparticles, because they're lipid, they can easily cross a cell membrane and get into the cell, right? That is what lipid nanoparticle vaccines are. Cells can actually do the reverse of it. They can make their own little lipid nanoparticles loaded with whatever they want, and then these nanoparticle can come out of the cell and then go to other cells. This is called an exosome. Now, is there a possibility of a spike protein exiting the blood vessel through an exosome, which would then be like a lipid nanoparticle loaded with a spike protein, easily enter the cell and then come out on the other side and then shed? That is the only possible mechanism. Having said that, as you can tell that I thought about it, I then did a lot of research about it. That is there a possibility of picking up something from the blood, creating an exosome, and exiting the exosome in the respiratory system, cavities, and there has been no study ever that shows that. So, correct, Doug, these are apocrine glands, the glands that make secretions. You're very correct. There is no study that shows exosomes doing that. And I actually deliberately went and looked for it. So that means, number one, it can be possible if this mechanism works. Number two, there is no such mechanism observed so far. Now then, the third possibility is that you put something in front of a person who is vaccinated and capture their breathing particles, they're exiting, and then check them for spike proteins. I haven't seen any such study as well. If somebody has seen, please share it with me, but I've not seen it. So Time for Tranquility says, there's a study that shows this, Dr. Drbeen. No. So I'll actually talk about that study. I actually discussed it. There is a study from Sweden that said that it is possible that exosomes from infected cell that have spike on them exit from the cell and enter other cells and bring spike in them. One. Secondly, there is another study, and this study is actually from I actually was discussing that study a few days ago. Let me see if I can just quickly Google for it. It's actually a very, that is a Stanford study that they said this is misinformation. It is Stanford study. The study was Stanford study, unique mechanism of mRNA vaccine. So I'm just putting all the keywords. This one, cutting edge. Circulating exosome with COVID spike proteins are induced by BioNTech Pfizer vaccination prior to development of antibodies, a novel mechanism for immune activation. This, if you see here, this is, if you look at their credentials, they are, I believe, from Stanford. This is a study a few days ago that I did, and I have actually gone in detail about this study too. So this is another study that says that what happens is that once a vaccine is given, Let's say here is the muscle and the vaccine is given. Then the muscle, some cells here have picked up messenger RNA and they have made the spike protein. And then they said this spike protein comes out loaded on an exosome and it circulates in the blood. And they said that this spike protein on the exosome actually then goes to other tissues and kind of prepares them just like a virus, pseudovirus with the spike proteins on it. And it kind of prepares them for developing the um, response to the spike protein. And they said not only this, they took these exosomes and they brought them in mouse. So if I go here, so exosomes were labeled with immunological immunogold and mouse anti-SARS-CoV-2. There is one more area here. Mice were, look at this, immunization of mice with exosome. So then what they did was they took these exosomes from people, they're from the blood, and they brought those to mice. It acted like a lipid nanoparticle for the mouse, and mouse become immunized. So I know this study as well. Although if you mention this study, they would say this is misinformation. Although it is here, the Journal of Immunology, number one. Number two, they are actually very respectable. Um, Look at this. Sandhya Bansal, Norton Thoracic Institute, St. Joseph's Hospital and Medical Center, Phoenix. Then this is Yale School of Medicine. This is St. Joseph, St. Joseph, St. Joseph, St. Joseph. There was someone, so Yale and St. Joseph. This is not a less credentialed team. And my discussion of this was labeled as misinformation. Twitter actually blocked my video and they sent me an email that we have locked your account because you have shared misinformation. And that was this. So to your question, time for tranquility. Yes, there is a Swedish study, I discussed it. There is this study, I discussed it as well. These still talk about the exosomes present in the circulation going to the tissues. None of them say that this exosome can enter a secretory cell, then stay intact, then come out on the other side intact in a respiratory surface, and then from there be shed. If there is shedding, this will be the mechanism, but there is no study that shows that mechanism. You're very welcome. As you can tell, my job is to read studies for you. Vashti Wood says, YouTube is really suppressing your channel. I only just received notification that you're like, yes, they are. And these questions can actually get me banned as well. They've already given me one permanent strike. Skyfrog says, the cool beans are clever. We got you to do a chit chat instead of answering more questions from previous video. Yes, you are clever. Is Parth here? Parth, I had asked you this question, that what are the cells that secrete various kind of substances, for example, sweat or saliva or hormones? What are various kinds and what is their mechanism of secretion? You should know. So you're in third year. So this is first year, second year. Madima Rose, thank you very much. Parth says back on channel. So with this, I think it is late. Let's close. And my standard way of saying, please like, subscribe, and share. And if you would like to support this work, there are links in the description. There's a question I see. Let's see if I can answer that. There are links in the description. You can buy Drbeen. That would be awesome. It is one time payment, no recurrence, 10 cent per video, 900 videos. Or you can become part of Patreon, Substack, Locals, YouTube. You can use PayPal as well. Okay. Skyfrog says, happy melatonin dreams. These are real vivid dreams. Uh, Vashti says, are you able to do an open question episode or series where we can interact without a specific topic? I'd love your instance to discuss changes to dietary cravings after C infection. I do that every Thursday and Friday on the other channel. And for last 2 days, I did that here as well. So yes. Now there was a question, golden time, last question. Sir, if someone got the immune mediated neuropathy after vaccination, then is it possible to see an activation of that same condition after getting COVID? Yes. And after getting vaccine or after getting something else that could be inflammatory. So that is the problem. If there are memory cells that get triggered, then it can happen, unfortunately. Okay. With this, Jean says, outstanding talks tonight. Thank you, Jean. Cynthia says, thank you, Dr. Mean. Very welcome. Margaret says, thank you. Very welcome. There's another question. Andrew says, about previous day topic, why do our cells need an additional loop? Oh, I saw this question yesterday as well. NLRC5 and IRF1, instead of just going straight from interferon gamma to triggering MHC1 production through the JAK-STATs mechanisms. I don't have an answer, meaning we could make a lot of our system and their processes more improved and better fashioned and optimized. But how? I mean, of course, there are both school of thoughts, creation, evolution. If it is creation, then creator had some thought and they did it. If it is evolution, then evolution created these mechanisms over time depending upon what was the environment. If it is creator creating the circumstances for evolution, then they both together did it. No idea why, but there are very fascinating mechanisms. Natasha says, will you advise still getting the vax even though we have medicines available if you are a long hauler? So very few, there are a certain number of people, not everyone, who have said that after long hauling, getting vaccine has helped them. And I can actually see that mechanism. That is the Neil Jones theory network hypothesis, where there is the anti-idiotypical antibodies that will be generated with the vaccine, or sorry, original antibodies will be generated by the vaccine, and then anti-idiotypical antibodies that are bothering us making us long haulers will bind with them, and they both will tumble away and we will feel better. Many times it comes back, but in some people they say we became okay. Now some people who are long haulers after vaccine, they say we felt bad. So it's a lottery as well. Okay, so with this, Skyfrog, with this, thank you very much. Please like, subscribe, and share. And if you would like to support this work, there are links in the description. I will see you tomorrow.